I'm Dr. Sheila Kilbane. I'm an integrative pediatrician here in Charlotte, North Carolina. I'm going to talk about Eczema 101. Over the past almost 20 years, after seeing thousands of patients, I've developed a program that helps heal and prevent the top most common childhood illnesses, eczema being one of them. I'm going to share with you today some of the things that I have learned, and I'm going to teach you how to look at the triggers of you or your child's eczema. The reason I'm doing this summit is I helped a family, the Rocky Sternagel, and as you can see from his before and after picture, he had pretty severe eczema. And the Sternagels are, one of the co-hosts of this summit. And when we started working with their son, they had tried everything. He was on a very restrictive diet. They were on all kinds of supplements and had tried everything they knew to do, but his eczema persisted. And we walked them through the process that I use in my practice. And as you can see from the photo, it's only about 6 weeks apart, and Rocky'd had eczema since birth. So we're gonna talk through these triggers and how to work through that. And what we're going to do is we're going to look at it also from a more mild standpoint. So I'm going to do another talk with Ryan. I do tune into the other talk that I do with Ryan during the summit about what we did with Rocky, and that will be for the more severe cases. So you saw that red, kind of angry, that can be a much more severe eczema. And what we're talking about is, you can see in this picture, this is a patient from my clinic, and it's more mild, and it's not as in-depth a treatment to help to improve these type of symptoms. So this is what we're talking about in this particular talk. The objectives today, we're going to go through the triggers of eczema, the importance of digestion, which that can often be overlooked. We talk a lot about gut health and leaky gut, and we talk a lot about supplements and taking foods out of the diet, but we also really want to focus on improving digestion. And then we're going to go through the steps to decrease eczema and reduce overall systemic inflammation. And I can't go through all of the steps in depth during this talk. I'm going to give you an overview, and then I have a lot of resources that you can use to uncover the triggers of your eczema or your child's eczema. My goal, anytime I do a talk, is to take you from people from either not knowing what they don't know to having too much information and being up on Dr. Google all night long and going from specialist to specialist, to having useful data. What is a strategic plan? And maybe you can do this on your own, but maybe what you discover in this talk is that you need to find a specialist who understands eczema in a more integrative or functional medicine way. We know that eczema is skyrocketing, the levels. It's, in 1946, it was about 5% of the population. In 1970, it was 12%. Now, some areas of the country, it's up to 30%. At least 31 million Americans are affected, and we spend at least $3.8 billion a year on it as a country. One of the first cases, and the point right when I was out of residency, when I realized there was a whole lot more to know about eczema than what I had learned during my medical training, was this case of Johnny. And I'd been seeing him since he was a baby. He had recurrent ear infections and eczema. And at his 9-month well visit, or around that 9-month well visit, Mom came in and said, Dr. Kilbane, I took dairy out of my diet and Johnny's eczema improved. And I thought, well, I don't know why that is, but, I'll read about it and figure out, and we'll decide what we do at a year of age, when normally we would start him on dairy. And a little bit after that, we figured out that eggs were also a trigger for him. So we took eggs out of his diet and her diet, and he had full resolution of the eczema at that point. So I didn't know it then, but what I know now is that about 1/3 of eczema is triggered by food, and two of the big culprits being dairy and eggs. It doesn't always mean that those are the foods that are triggering it, but those can be two of the triggers. And many of you may already know that, or you may have already gone off of certain foods. So we're going to get into more detail now about what are some of the other triggers of inflammation, how the gut microbiome, how that can contribute to eczema, and the skin microbiome. The skin microbiome is often very overlooked. And even in in integrative and functional medicine, is we often we talk about everything being from the gut outward. But I'm going to share with you about the skin microbiome today. I like to be pragmatic about how we work through the triggers of inflammation. So I'd like to simplify things. So we say we have 5 main triggers of inflammation. And first of all, we have our genetics, right? And then it's a way that our genetics interact with our food, our environment. We have environmental toxins, infectious diseases, and stress. And they can all contribute equally to illness. Eczema, we do know what are more triggers than others, but all of these different areas can contribute to that. In terms of food, I'm going to get into more about the food in a later part of this talk, where I'm going to share with you what I do in my clinic step by step. But what I have also created is a download explaining the different ways our bodies can react to foods. So foods can trigger inflammation, and it can be very confusing. And a lot of the patients that I've seen have had food allergy testing, and because it's negative, they might say, I don't need to go off of any foods. But we can in fact have food sensitivities. And so we have a food sensitivity, but we can also have something called celiac disease, which is an autoimmune condition where you have your body reacts to gluten, which is the protein that's in barley, wheat, and rye. We can have food intolerances, but that's more of like a lactose intolerance. And a lot of people get bloated and gassy when they eat dairy. And then you can have a histamine intolerance, and that can definitely play a role in eczema as well. But again, I've created a download handout, because if we went through that in detail, we would spend the whole time that we have together right now on that. So go to my website and you can get that. What I want to talk about first, second, the second trigger is environmental allergies, and dust mites can be a big one with eczema. All the other ones, we've got indoor and outdoor allergens, so cats, dogs, cockroaches, dust mites, and mold. And then we've got the outdoor allergens, so we've got trees, grasses, weeds, and molds. And molds can be indoors and outdoors. And then I want to make that distinguishing factor here of mold, of an allergy versus a mold toxin. So when we are looking at mold allergies or any environmental allergies, you can have that tested through either skin prick testing or blood work. And I often prefer blood work for kids with eczema, because I had one child, not many, but a few over the years, that when they had the skin prick testing, they actually had an eczema flare. So if, many primary care doctors and definitely allergists can do the blood work to identify what the environmental allergy may be. So that's one easy thing that you can do to help decrease the inflammation. And then mold from a water-damaged building, that's an entirely separate entity, and that's where they're secreting toxins. So that's where you want to look around your home. You want to look, have you had any appliances that have leaked? Do you have a basement that floods? Do you have a crawl space that might have mold? Is your HVAC or your vents, do those have mold? So if you have someone in your family and you've done a ton of things to resolve the eczema and you just can't figure it out, start to really look to see if you might have mold somewhere in your home or in your environment that you're getting exposed to. And then when it comes to stress, I'm going to refer to that here as the itching that we get with eczema. And eczema can also create, if we have underlying anxiety or we're more on the nervous side, that can definitely make an eczema flare up worse. But we want to, once we start to get the symptoms calmed down, that's what helps to calm the nervous system down. And the itch with eczema actually travels, itch is the mildest form of pain. So it travels on those same receptor sites. And if we can start to control the itch with eczema, that actually helps to calm the nervous system down. And antihistamine medications, even though we try to do things as naturally as possible, sometimes an antihistamine at the beginning can be really helpful to help address that nervous system calming. And if we can help get into a deep restorative sleep, that's also going to help improve the eczema. And a lot of families come to see me because they don't want to do medications. But in this case, it can be really helpful at the beginning. And with the Sternagels, that was one of the things. Teddy and Ryan really didn't want to do medications. As I said to them, I'm pretty sure I can help Rocky, but I don't think you're going to love what I have to say. And we did use some prescription medications, and an antihistamine was just an over-the-counter antihistamine was one of the first things that we introduced. So that's taking a step-by-step approach through those 5 triggers. Now I'm going to get into a little bit more depth on this inflammation and illness. So most people have heard of this concept of inflammation, and when our cup, I always describe it as a cup of water. When our cup of inflammation is overflowing, that's when we have symptoms. And often with eczema, many other illnesses go hand in hand. Reflux, recurrent ear or sinus infections, chronic runny nose, asthma, constipation or loose stools. So as we're decreasing this overall inflammation, often those other symptoms improve. And when it comes to decreasing inflammation, the pharmaceutical industry knows this well, right? Steroids, topical steroids are the first and the primary tool that we have in conventional medicine to help eczema. Sometimes we'll use oral steroids. We'll use injectables for other things, or IV if the kids are in the hospital. We'll inhale steroids, we'll squirt them in our nose. And NSAIDs, ibuprofen is an NSAID, so a non-steroidal anti-inflammatory medication. What we're going to do with today, and what we do with integrative medicine, is we start to decrease inflammation from the inside out. We use medications, and that's what I love about integrative medicine, is we don't throw the baby out with the bathwater. We use our good conventional medical tools when needed, and we combine that with integrative medicine. So when you take that overall picture and you start to understand this concept that inflammation is what creates a leaky gut, right? Most of you have heard that term leaky gut, and that's what leads to illnesses. And with this graphic, I just want you to get this illustration of that cup of inflammation that's overflowing can contribute to a lot of these other illnesses as well. When our nose is congested, we're mouth breathing, we're not sleeping as well, we might have restless leg syndrome, so we're all over the bed at night and we're not getting that good restorative sleep that is so important for the immune system. And then as we go through those triggers of inflammation and decrease them, that's where we start to see an improvement of all the symptoms. And it's also with the nervous system, because we don't have fences in our body. When kids' eczema flares up, they can also have more behavior challenges and maybe anxiety, maybe meltdowns. And I'll share with you about one of my cases where that was definitely the case, and I see that all the time. Moving on to gut health. The gut, you all know this. We've got more bacteria in our gut than we have cells in our body. It's called the microbiome. We have microbiomes all over our bodies, and the research is exploding in this area. We're learning so much about this now. So we've got a microbiome in the gut. We have one in our mouth, in our nasal passages, on our skin, in our vaginal canal. And think of it like gardening. It's not about killing the bad things or, and and just killing the bad things. What we have to do is we've got to give the fertilizer, we've got to give the right foods so that we promote the growth of the good, healthy bacteria while addressing the not so beneficial bacteria. And this is where restoring digestion comes into huge play. And this is where I think in my clinic we do this a little bit differently. And I have a wonderful integrative pharmacist, Deb Allen, who works with me, and she is the mother of 16-year-old triplets. They were premature, and when they were in the NICU, they were on, a lot of medications as in their toddlers and 4 and 5. And she really did a tremendous amount of research. And when it comes, sometimes we will take these kids will end up on such restrictive diets, and it's hard for parents, it's stressful. But what we have to do is even go a little bit below that, and we've got to make sure that our bodies are breaking down the nutrients and absorbing them, because we need fats to make up our cell walls and to make our hormones, and we need proteins also to make up the receptor sites on our cell walls, to make our neurotransmitters. Our neurotransmitters in turn are what help us to fall asleep and to stay asleep, right? And our serotonin helps us feel good. It helps our GI tract move. Our dopamine helps us to feel good, helps us to focus in school and do our math homework. Our melatonin is what helps us to fall asleep. Our GABA helps us stay asleep. So those are just a lot of terms, but those are basically the chemical messengers in our body that help our systems do what we need to do on a daily basis. And how do we know when our gut and our digestion is working? Well, we look at our stools, of course, right? We want to look at poop, and sit down with whoever in your family is struggling with eczema and really go through this. We want a good, either a snake-like or a sausage-like looking stool. And the other one, that's when we know we're starting to make headway, is when we have one good daily easy bowel movement that's formed. And when that's the case, that's when we know we're breaking down our fats and absorbing them, because our fats make up our cell wall. And when we're talking about skin health, we need the good fats in order to have that really good, healthy skin. Looking at the leaky gut, and this is where I like to bring things. We talk about cell biology, high school biology in the clinic a lot. Because when you bring it down, if we're talking about leaky gut, so let's talk about a gut cell. If we don't have a good, healthy gut cell, if we don't have proper nutrients, if we don't have a nice fluid cell wall with the right ratio of anti-inflammatory fats, then we're going to have kind of a rigid cell wall where nutrients aren't going to be able to go in or out. And then when we go into our small intestine, those cells are going to be spread apart a little bit. Normally they should have these nice tight junctions. And if those are open a little bit and we get inflammation, those undigested proteins that are getting absorbed into the bloodstream, that sends a cascade of inflammation. And that's where we get those rosy cheeks, bumps on the cheeks, bumps on the back of the arms, and eczema, those runny noses. And that's also where we start to see those neurologic shifts, whether it's anxiety, behavior changes, trouble sleeping. And when it comes to that, as we restore that digestion, that's what's going to help us. We have 7 layers of the skin, and we need adequate blood supply. We need those good, healthy cell walls to make sure we've got all that healing of the skin layers. And that can take some time. And same thing with that cellular integrity. We've got to restore the GI function. So you're going to hear me talk about, when I get into more of the steps to what we're going to do, is I want you to do this for a good 3 to 6 months to get that good, solid, long-term improvement. And the third area that often gets overlooked is the skin microbiome. And this was the case. Rocky was a good example where we could be on perfect diet with perfect supplements. But if we're not if we're not addressing all the triggers of inflammation, we're not going to really get that overall improvement. And we know with people who have eczema, they've got a higher bacterial count on their skin. In particular, they have a staph bacteria. That staph secretes something called a delta toxin. And if we don't address that staph, that delta toxin is going to continue to trigger inflammation on the skin. And you can see with my graphic here, so we've got it's a two-way street from the staph on the skin with the gut. We always, in integrative and functional medicine, people will always say, well, the gut triggers the inflammation on the skin. And that can be true in some cases. But there are also cases where the staph on the skin, when the skin is not intact, there's newer research to show that that can actually contribute to a leaky gut. And once we address that staph, that's then where we start to see that magic happen. And again, this is going to be a much lower percent of people with eczema that are going to need to go on to address the staph. And what we use is something called the Dr. Aron Regimen that Ryan and I are going to be talking about when we're doing another talk during the summit. So that one, tune into that one. And so it's a two-way street between the gut microbiome and the skin. So we want to make sure that we're addressing, if the skin isn't starting to improve when we've removed some foods and done some really good gut work, that's when you have to look to the skin. And those are the times where you're looking at that red, similar to what Rocky had, that red, angry-looking skin. It's irritated. That's an indicator that strep may be playing a role on the skin. In terms of this concept that the skin not being intact can contribute to a leaky gut, I just want to share this case with you. So this was a case of a teenage boy who came to see me, and he had had a terrible burn on his skin 3 years prior to them coming to see me, where he'd passed out in the shower, and on his way passing out, he hit the hot water, he hit the faucet and it turned to the hot water, and he got scalded on about a third of his skin where he had third-degree burns. And so he made it through that and was really doing great, had his skin grafts, but he had developed eczema on the non-grafted skin, and he was getting recurrent MRSA boils, and that was why they came to see me. So what we did together is we definitely used the Dr. Aron Regimen to address the staph on his skin, and then we checked him, and he actually had developed a lot of food allergies that he didn't have prior to the burn. And so we worked and did that good gut healing. We got him on some good fats, digestive enzymes, and he had a beautiful improvement. As you can see, just the nice coloring, for his, the latter picture. And so anyway, that's just a good example of that two-way street between the gut and the skin. Now, what we're going to do, I'm now going to shift a little bit, and we're going to go through some of the steps, but I want to reassure you that I'm going to just go do a cursory overview, but I have several resources that are going to help you work through this at home. And the first thing I want you to do is get this cup of inflammation, and I want you to estimate the percent that you think each of these different triggers of inflammation may be contributing to your child's health issue. We want to get an assessment. We want to get, where are we on, if we're making a roadmap, where is our first point? And in terms of the resources, I have a book, I have a workbook, I have an online course, so you can, there are many ways for you to access this information. So with those triggers of inflammation, now we're going to talk about food, and we're going to talk about how I do this with my practice, because I also want to make sure that we're not missing the forest through the trees. And because some people they'll start to take dairy out of the diet, and gluten and eggs, but yet they still might be having artificial dyes and colors, and the kids are eating a lot of sugar. So we're going to take it step by step. But the first thing I want to talk about are those food allergies and food sensitivities. Is many of you have heard about the top 8 allergens, and those are the things that in the adult world, a lot of times the practitioners will have people go off those top 8 allergens all at once. And I don't do that in the pediatric world because it's really stressful for families. It's hard, and we don't want the kids losing weight. So what we do is we focus first on the Mac Daddy of foods that triggers inflammation, and that's just dairy. And so we talk about dairy, and then in eggs, those can be the 2 big culprits. And then gluten, is also one of the bigger culprits. And then those other ones like corn, soy, peanuts, tree nuts, and fish, those can be triggers, but they're less, a lesser amount. And then those other 3, the shellfish, the citric acid, and the sesame, those are also lower on the totem of creating illnesses, but they can also trigger things. I'm going to give you one case of a patient with citric acid, and it was the case of one of my partners. And it was a young boy who had asthma and eczema, pretty severe. And dairy was one of his triggers. So they went off dairy and had an improvement, but he still had this patch on the back of his leg. And what they figured out is citric acid was the trigger. So they took the citric acid, which is, things like grapefruits and oranges and lemons and things like that. And he had an improvement, but he kept getting this flare up around his mouth. And what mom figured out, so he, as part of his asthma treatment, he was on an inhaled steroid, and he did it as a nebulizer. Well, he was on budesonide or Pulmicort, it's the same thing. And mom pulled out the packing slip from the pharmacy, and she figured out that there was citric acid in it. So they switched him from that, and they just did a puffer, an inhaler, and that resolved the eczema. So really getting clear on the triggers whenever possible is going to help lead you to figuring out how we're going to have that long-lasting improvement. And again, I have a handout for these different ways. So foods can trigger inflammation in many different ways. Food allergies, food sensitivities, which is more so what we're talking about here, and then we've got celiac disease, food intolerances, and then histamine intolerance. I do just want to talk about for a moment because histamine can be a big trigger for eczema. And there are a lot of really healthy foods that can increase our histamine levels. And it can be things like avocado and strawberries and bananas and seafood. Dairy, of course, is one of those things as well. Tomato. So I want you can go to my website and download that so you can get a list of the histamine foods. You don't need to pull all those histamine foods out of the diet. But if you've done some of these major things and you are still finding the trigger, I just want you to look at that list because one of them will trigger. You might say, every time we have spaghetti, Johnny's eczema flares up. So you'll just pay attention to those, and it doesn't mean they necessarily have an allergy to those foods. It just might mean that it's triggering a histamine response. So the first step that I do in my program, so what we do is we first do a mini cleanse, and I say a mini cleanse for kids, but it's very applicable to adults. So we do a mini cleanse for kids, and then we'll talk about dairy, and then we talk about gluten, but we will also talk about supplements. So with the mini cleanse is you can take a day and change each of these, or you can take a week, or you can take a month. But we want to decrease those sugary drinks, decrease those artificial dyes and colors, decrease the packaged food, snacks and foods, decrease that refined sugar, decrease those processed fats, and then decrease the processed meats, and then decrease the fats. So the deli meats are one thing too, because I think we often think, this is a good thing, is my child is eating meat, but you want to be really careful of those. So in the handouts that we have, is you will have, I have the replacement foods, right? And it's too much, we don't need to go into it right now because it's a gradual thing, and you just want to slowly shift those foods, because as you increase the good healthy foods, That is where we're feeding the gut we're feeding the healthy bacteria in the microbiome. And we want that really nice, good, diverse microbiome. And that's what is going to give us those overall long-lasting improvements. And then the second thing, if that doesn't resolve the issue, then we go on and we remove dairy while we add in the supplements. And I do this slowly with kids because they can get a withdrawal type effect if we stop dairy and or gluten too quickly. So I do the dairy over a 3-week period of time, and then if symptoms are persisting, then we move on to gluten. So we take the first week and we pull dairy out of breakfast while we're adding a probiotic. And you want to start the probiotic at the start of breakfast and at the start of dinner, because that's going to help us decrease that inflammatory impact that we get from food. The second week, we're going to take dairy out of lunch and we're going to add in a digestive enzyme along with the probiotic at the start of breakfast and at the start of dinner. The third week, we're going to take dairy out of dinner and snacks while we add in an omega-3 fat. You know, it could be in the form of fish oil, could be in the form of foods high in omega-3 fats. And then the fourth week, you're going to keep dairy out and you're going to do just dairy for the following 3 weeks. And then you're going to add in vitamin D and either a whole food supplement or a multivitamin mineral. And I want you can see where I've got at the bottom there, I have, we want to make sure that you're monitoring symptoms as you add in each thing. And I do this very slowly and deliberately because you can have reactions, good or bad, with supplements. We want to make one change at a time so that when we see improvements, either good or bad, we know what your child has reacted to. And then here's the supplement start guide. This is also just for a reference so that it's easy for you to think through and to work through this. And then we're going to move on to gluten. So you'll continue the supplements, and only if the symptoms are still persisting, if the eczema is still there, you can move on to removing gluten. Or if you suspect eggs are the issue, you can remove eggs, and you can remove the other foods much more quickly than you can the gluten and dairy. You can just stop them altogether. But I don't like you to continue removing foods beyond dairy and gluten and eggs unless you're working with a practitioner, because we need the nutrients in kids. And over the years, I've seen a lot of, and in adults, I've seen a lot of kids come in with nutrient deficiencies because we've taken so many foods out of their diets. So please work with a practitioner if you're getting to that stage. And what I'd like you to do is you want to keep up, once you figure out where the magic is with your child and what the triggers are, we've got to keep up the supplement and the good nutrition for at least 3 to 6 months. So think about how long it takes to heal a sprained ankle, right? When you sprain an ankle, it takes a good 3 to 6 months until it feels like your joint again. It's the same thing with the gut and similar to the skin. It takes a while to get that full thickness healing and to really get the gut so that we have those nice tight junctions again. And with probiotics, we have so many good benefits with probiotics. They decrease inflammation. They support digestion. They support the immune system. They're going to support good bowel movements. When it comes to, this is the patient, I showed you this picture earlier, and this little boy was an 18-month-old, and he was already off of, several foods that were triggering him, but he was still having this eczema. So the only difference between this before and after picture was the addition of a probiotic. So that's how powerful restoring digestive function can be. And we had to do more things with him. But he also had such a profound improvement. This little kiddo had severe meltdowns all day, every day, that this family had never been able to go out to a restaurant since he'd been born. And it was affecting the whole family and his siblings. And when we finished and decreased his overall systemic inflammation, like one of our last visits, they had been able to go out to a restaurant for the first time. So that was huge, and I love that. When it comes to digestion, whether in kids or adults, there are many factors that decrease our body's digestive enzymes and our ability to break down food and absorb it. You can see all these. It's stress, it can be our genetics, it can be aging, lack of physical activity, poor quality sleep, prescription medications. So many people are on antacid medications, and that can be really harmful on digestion. Recurrent illnesses, inflammation and leaky gut, poor quality food, chewing too quickly. We have all of these things that can impact our digestion. So we want to use a good, high-quality, plant-based digestive enzyme. And I say plant-based because that is not going to disrupt our normal secretion of digestive enzymes from the pancreas. If we're using animal-based pancreatic enzymes, that can suppress our body's ability to secrete enzymes. So get a good plant-based enzyme, and that is going to help our protein absorption, decrease our inflammation, our fat absorption. It's going to enhance bowel movements. And this is also, we talk about this in our clinic. If we just could do one supplement and we had to only pick one, it would probably be a digestive enzyme, so that your body would be absorbing the good, healthy, expensive organic food that you're buying. And this is where we get back to that, the happy face, the happy bowel movements is when we restore digestive function. Then we're giving our body the natural resources to have our healthy cells. This is another picture from one of the patients in my practice, and we had to use the whole, we had to look at all his gut microbiome, his skin microbiome, what his triggers were, and he also had some environmental allergies. They actually had some toxic mold in their home, so we had to really go through all the pieces of the puzzle. But when he came to see us, he was embarrassed to wear shorts to school because he didn't like the way his legs looked, and he was coming in full, wearing shorts and everything. And that's what I want for you and your, anyone in your family who has eczema. And it's always about this cumulative inflammation roadmap. So because eczema can be a lifelong challenge for some people, if there is a trigger that is continuing to be the trigger, that may always be one of the triggers, and you may have to avoid it. And you may not, for example, if dairy is one of the triggers, you may have times where you're at a party or it's holiday season and you want to have some dairy. So that we can get we might start to get off fall off the wagon for a little while, and we're getting exposed to these triggers. All you do when things start to get worse is you just say, okay, we're going to get back on the supplements, we're going to get back to eating better, and we're going to do it again for another, maybe you only have to do it for a month this time to get the symptoms under control. And then knowledge is power. And when you know what's triggering the symptoms, you have a lot more tools in your toolbox to decrease the symptoms. And that has been the case with Rocky. And these are some of, you can see some of the issues that he has on his body. And you can see this beautiful picture of him in his diaper with that beautiful clear skin. And his mother will text me and say, oh my gosh, she said, I was dreading the warmer weather because I knew we weren't going to be able to put him in shorts and a t-shirt, but he's clearly able to do that now. And again, we'll talk more in depth about the more severe eczema in the other talk that I do with Ryan on a deeper dive into eczema. But in summary, when we're talking through eczema, we really want to comb through those triggers of inflammation. We absolutely want to address the gut microbiome, but we also want to make sure we're addressing the skin microbiome. And it has been an absolute pleasure to be with you here today. And I hope we've got some good takeaways that you can start to implement, and you can check out our resources. We've got some great free downloads. I've got my book, a workbook, an online course, whatever is going to help you uncover the triggers of inflammation for your family's eczema that will make me very happy to help support you. with some of these resources. Thank you so much.